ladies and gentlemen. Today's lecture is popliteal fossa. I'm sure you know what is popliteal fossa. Popliteal fossa is just a space at the back of the knee joint. Yesterday or day before yesterday, I discussed with you the knee joint. And at the back of the knee joint, there is one diamond-shaped space known as popliteal fossa. So we call it a diamond shape because it has 4 sides. It's just like 2 triangles, one above and one below. When you now imagine a line passing along this line, horizontal line from the medial and lateral femoral fondi. So you imagine a line there dividing this transversely. So you have one triangle above, you have one triangle below. The union of the two, that is what we call diamond shape. So popliteal fossa is a diamond-shaped space with 4 sides. So above we have 2 borders, and below we have 2 borders. All these are the boundaries of the popliteal fossa. If you can remember your thigh anatomy very well, you know that on the lateral side at the back of the thigh, there is this biceps femoris muscle. Both the short and the long heads of the biceps, as they come and insert on the fibula, the biceps femoris tendon forms the superior lateral border of the popliteal fossa. Similarly, on the medial side, if you can remember the anatomy of the back of the thigh very well, at the back you have semimembranosus on the superior medial side, forming the border of that popliteal fossa. It is reinforced by another tendon of one muscle, what we call semitendinosus. So semitendinosus reinforces the tendon of semimembranosus. So semimembranosus is actually the one that forms the superior medial border of the popliteal fossa. Similarly, when you come down at the back of the leg, there are 2 muscles, 2 important muscles, what we call gastrocnemius. You have one on the medial side, and then you have one on the lateral side. So these 2 bellies of the gastrocnemius, their own tendon is down. So the 2 bellies, we have the lateral head, we have the medial head of the gastrocnemius. So the 2 heads together now, one here on the medial side forms the inferior medial border, and the other lateral head forms the inferior lateral border of the popliteal fossa. So we can see that the popliteal fossa is formed above by biceps femoris on the superior lateral side, semimembranosus reinforced by semitendinosus tendons on the superior medial side, and then inferior medially it is formed by the medial head of the gastrocnemius, and then laterally is formed by the lateral head of the gastrocnemius. So what are the structures that form the floor of the popliteal fossa? I'm sure you know that the thigh bone is what we call the femur. So the femur at the back side of it, at the lower or distal 1/3 of the femur, at the back side of it, there is one smooth surface, what we call popliteal surface, that forms part of the floor of the popliteal fossa. Similarly, yesterday while I was discussing the knee joint with you, I discussed with you the knee joint capsule. That knee joint capsule encloses the entire knee joint. So the back side of the knee joint capsule here also forms part of the floor of the popliteal fossa. So now we have seen that the popliteal surface of the distal part of the femur forms part of the floor, and then the back side of the knee joint capsule also forms part of that floor. Similarly, there is one muscle also that forms part of the floor there, what we call popliteus muscle. Together with its own tendon that runs obliquely downward. So the popliteus muscle and its own tendon also forms part of the floor. So the floor is formed superiorly by the popliteal surface of the femur, inferiorly by, or you can say in the middle, is formed by the back side of the joint capsule of the knee joint, and then inferiorly by the popliteal muscle and its own tendon. These are the structures that form the floor of the popliteal fossa. How about the roof? The roof is formed by the skin. The skin, the superficial fascia and the deep fascia, forms the roof of the popliteal fossa. And you are aware that the fascial latter is deep fascia of the thigh. So it extends down also to also form part of the roof of the popliteal fossa. So we have the skin, the superficial fascia and the deep fascia all forming the roof of the popliteal fossa. Now, what are the contents of the popliteal fossa? Popliteal fossa has the neurovascular bundles, situated inside it. We have the artery, which is the deepest. Why it is the deepest? Because of its importance. Then the second one that lies superficial to it is the popliteal artery, popliteal vein, and then lastly is our tibial nerve. If you can remember the sciatic nerve, as it descends down from the back of the thigh, it divides into two, lateral branch and the medial branch. The lateral branch is our common peroneal nerve, and the other one is the tibial nerve, which is this one. So the tibial nerve descends down from the lateral border, superior lateral border of that popliteal fossa. It descends down and lies virtually in the lateral side of the fossa. So initially, when you divide this fossa into two, the upper triangle there, the arrangement of this neurovascular bundle differs from the arrangement in the middle, and also differs from the arrangement of this content in the lower aspect. So in the upper aspect, the neurovascular bundles are arranged as follows. From medial to lateral, you have the popliteal artery, the most medial. And then this next one is the popliteal vein. The other one is the tibial nerve. So that is the arrangement like that: artery, vein, and nerve. So in the middle side of the fossa, you have the artery, the deepest, then you have the vein, then you have the nerve. That is the arrangement of the neurovascular bundle in the middle part of the popliteal fossa. But when you come down, the arrangement also differs. You get my point? So what happens is that when you now come, the popliteal vein, it is the most medial in the inferior side of the fossa, then followed by the artery, then followed by the tibial nerve. So the arrangement now becomes VAN instead of AVN above. Above you have artery, vein, and nerve. But below you have vein, artery, and nerve. You get it? VAN. There is AVN. Are you clear? So now that is the content of the popliteal fossa. What are the clinical application or clinical anatomy of this popliteal fossa? You see, what is going on is that the popliteal fossa actually is very important because it contains some important structures, especially the popliteal artery. So the popliteal artery can get ruptured, especially during accident. When somebody has that dashboard injury I was discussing with you the other time, the popliteal artery, when the distal end of the femur is fractured, or the proximal end of the tibia is fractured, this artery can be torn. And bleeding, the person may be bleeding inside this popliteal space because it is a potential space. Bleeding, blood can accumulate in there. That is one. Two, the popliteal artery can also become swollen, especially in one condition that we call popliteal aneurysm. So the popliteal artery, because of diseases, can cause this artery to get expanded within the fossa and cause what we call popliteal artery aneurysm. And that one also can rupture because as it expands too much, it can burst out, and the person can be bleeding inside the fossa. So apart from the popliteal artery aneurysm, you can also have what you call popliteal cyst. Popliteal cyst, we have joint capsule at the back here, and I told you before that the joint capsule is being lined by the synovial membrane. So that synovial membrane now can exude outside the joint capsule and form something like a cyst there, what you call popliteal cyst, and it can become swollen up, and so the person can see the swelling at the back of his knee. And so that is a very simple kind of thing. The surgeon can just go and extract the liquid inside because it's just a serous fluid in there. And so as soon as you draw out the liquid from the cyst, that is done. Although actually it may occur if you don't go and take the patient to the theater, cut it open, and then you now extract the liquid, and then you excise the synovial membrane that exude out, and then you suture it back. That is for the popliteal cyst. Similarly, one can have lipoma around that region. You know, we have superficial fascia in there. So the fatty tissue inside the superficial fascia there can also form lipoma. The when we hear this word lipoma, it's just like it's swelling made up of fatty tissue in there. That's what we call lipoma. That one too can also be excites, you know, so it can occur also at the back of the knee joint. Similarly, if you want to do an operation in the leg, you can also do what we call tibial nerve block. You can block this tibial nerve, or you can block the common peroneal nerve in the popliteal fossa, especially if you want to do surgical operation in the leg. So you can now inside your knee, because you know the anatomy very well, you know where the nerve is, either the tibial nerve or the common peroneal nerve. So you can now do your nerve block, either the tibial nerve or the common peroneal nerve. So you can block it, and the person will be like when you are doing the surgery. These are part of the anatomy.